Alright, as always, you can go to YouTube channel My Medical Nightmare and see 40 plus hours video on everything that happened to me. June 25th, 2024. UAB to acquire Ascension St. Vincent's Hospital System in $450 million deal. This is according to AL.com. Included in this agreement is a change of hands in ownership to St. Vincent's Hospital in downtown Birmingham, St. Vincent's East, St. Vincent St. Clair, that's in Pell City, St. Vincent's Blount, and St. Vincent's Chilton. Physician offices are also included, the freestanding emergency department in Trussville, the 119 campus and imaging centers, as well as current Ascension St. Vincent's services, facilities, caregivers, associates, and their network of providers. UAB says they are hopeful that most, if not all, of the Ascension St. Vincent's roughly 5,000 caregivers and associates will remain in their roles. The representative says UAB Health System plans to operate the hospitals without any changes and has no plans to eliminate or consolidate services. Alright, so what can people and the general public out there seeking health treatment in the Birmingham, Alabama area expect in terms of service and patient experience in the future when going to these hospitals and doctors? My general experience dealing with UAB is one of waiting and no service forthcoming. And I thought I'd put together this video sharing my first-hand experience trying to make an appointment with a UAB medicine primary care physician, going to the UAB hospital emergency department with my injury. At the time, I had around 6 inches diameter infection in my head. It was standing room only, and the hospital would not admit anyone outside of the triage queue unless they collapsed and passed out on the emergency department floor. And finally, my experience waiting 3 months on a waiting list to see a UAB neurologist, only to be called and told my appointment was canceled and I would have to wait another month. Alright, UAB Primary Care, Birmingham, Alabama. They told me on March 23rd, 2023, that if I wanted to see a primary care doctor, that's like a jack of all trades family doctor, as a new patient, I would have to go on a waiting list, and the soonest that they could see me at the Leeds, Alabama clinic was November 2023. And that is an 8-month waiting list. If I was willing to drive into downtown Birmingham, I could be put on a waiting list for August 2023. That's 5 months. I did some research and some asking around, and from what I can find, it looks like 8 months wait to see a primary care doctor in the United States of America. This is probably a bit too long. For an organization the size of UAB, I think this is really unacceptable. If you drive downtown Birmingham on the south side, you'll see that the entire UAB campus is around 83 city blocks. A good portion of the real estate in downtown Birmingham on the south side, it's UAB. Becker's Hospital Review in 2020 rated UAB the 8th largest hospital in the United States of America with 1,207 beds. So yeah, I think for them to have a primary care network that makes new patients wait 8 months, This is totally unacceptable. I found out something interesting in that phone call, and I'll play this excerpt.
It shows it was created in March of 2022. It says he did have an appointment back in 2019 with neurology.
The receptionist here, she tells me that my chart was printed in 2022. And this is interesting. I was referred to UAB Neurology by Dr. Perry L. Savage, Sr. of Ortho Alabama Spine and Sports. And you can see my uploaded medical records and documentation with him and that medical practice at my YouTube channel. It's My Medical Nightmare. I showed him printed out CT images, and we both looked at MRI pictures on a CD-ROM that showed broken skull bone and around 6 inches diameter infection in my head. And I knew what I was looking at. I asked him about those anomalies, and he told me with a straight face right in front of me that there were no injuries present in those pictures. I put the pictures up on that YouTube channel. They're in many videos. You can see for yourself the truth about my injury. So from that visit, yeah, I was referred on to UAB Neurology in 2019. The last contact that I had with anybody at UAB as a patient, this was in 2019. So it looks like my chart may have been updated in 2022. Yeah, and I'm real interested to know who printed this and for what reasons. And taking all this into account, yeah, I think this opens up the possibility that I may have been blacklisted by the UAB network, because what I was doing in 2022 is I had started documentation efforts on the fact that I had an injury that was misdiagnosed by other doctors. And yeah, I was going to UAB to try to get another opinion on this.
Calling UAB Medicine Leads. For prime care and pediatrics, please press 1.
Thank you for calling UAB Medicine. This is Bailey. How may I help you?
Yes, ma'am. I would like to make an appointment with a doctor, please.
Okay, sure. I can help you with that. Have you ever been seen at UAB before for anything?
Yeah, I went to the emergency department, and I stood there downtown Birmingham for 5 hours waiting to be seen, and I never saw a doctor. I got tired of standing. I had to leave the emergency department.
I want to make you aware before we get started, for a new patient here at the Leeds Clinic in primary care, we are booked until November, and we do have a wait list as well that I could add you.
Okay, I would just like to confirm, you say that the earliest you can see me is November. I'm calling, and my calendar says it's March 23rd, 2023. Is that correct?
Today is, yes.
So that is, let's see, April, May, June, July, August, September, October. That's 8 months from now.
Right.
For a primary care visit, there's no other place I can go to that will see me any faster?
Okay, so we have the Whitaker Clinic, which is in Birmingham. The first available there is August the 7th.
Yeah, I really don't want to wait that long. It's not professional business practices to make customers wait so long for such a menial service. My condition worsened and the infection grew. This is late summer. Get into late summer 2019. I felt like I was dying. I decided to go to UAB Hospital. emergency department in downtown Birmingham some weeks later for another diagnosis. UAB's emergency department is much different from St. Vincent's East Hospital in Birmingham, Alabama. The way they run it is a lot different. The space is small, crowded, dirty, old, with very little privacy for patients. Many unsecured infectious disease vectors exist in this environment. Among them, sick homeless people off the street, which apparently take refuge in the emergency department waiting room. Yeah, I was sitting there, and they talked to this one guy who came in, and he said, "Oh, you're in here like regularly." So there's people that just come off the streets, and they see him regularly there. And by far, the most common person I saw in this waiting area was an overdosing or overdosed or withdrawing drug addict. Another issue, disease vector, pathogen vector, infectious disease vector is mosquitoes. There are mosquitoes that fly around in the waiting room of UAB Hospital Emergency Department waiting room. They have a public water dispensing machine. Poured me some water in a styrofoam cup. Little black worms, maybe half an inch long, dropped into my cup from the public water dispenser, where it's not cleaned. I can't drink that, I'm sorry. But thank you, UAB Hospital. Homeless people off the streets, mosquitoes, worms from the public water dispenser, not a good situation. UAB has a lot of money, though, apparently, as is evidenced by the massive sprawl of real estate that exists in Southside Birmingham. Go to Southside Birmingham, drive around, look at the schools, the hospitals, businesses. Look at the satellite businesses that exist around UAB that service UAB, serve UAB, take the overflow from UAB. Kind of like the place I went to. All around UAB, there's a medical industry, and it's all based around University of Alabama at Birmingham. Much of the staff in the emergency department at UAB is visibly young. The atmosphere is like a college dorm room. Many staff had fast food takeout and snacks on the triage area and ate and drank as they performed triage and medical procedures, emergency department medical procedures. It did not look like a professional environment. There was a long wait at UAB emergency department. I was told several hours for my triage condition, despite my serious symptoms. If you want to know my symptoms, check out some other audios and videos. I have a broken skull. I have a basilar skull fracture, busted up, occipital condyle condylar canal. It's leaking CSF fluid into my neck, and by this time I'd become infected by parasites. A very serious issue. I waited 5 hours. I stood there waiting 5 hours. I was never saw. I was never attended to. I was never called back and saw any doctor beyond the front waiting area. I saw other people that had been there for 10 plus hours waiting. 10 hours waiting in the emergency department. Some people, if you got an emergency, you can't wait 10 hours, or you can't wait 5 hours. Maybe you can't wait a couple of minutes, but there was a waiting room full of people there, and it's unacceptable. I mean, UAB, come on, this is professional stuff, right? All right. Others became angry on the wait and were asked to leave. Somebody said, "Hey, man, I've been waiting here 5 hours. Could a doctor see me, please?" And they were told, "Sir, you keep talking like that, you're going to have to leave." So sitting around this place for 5 hours, I noticed something interesting. Every couple of minutes, somebody would come out and they would call somebody's name. Then they would disappear, and 5 or 10, 15 minutes would pass before they'd come out and call another person's name from the triage list. Some of the people in this waiting area had been there for 10 hours or more. But they're not able to accept new patients very quickly because they keep calling the same people's names. And 2 or 3 hours after I got there, they were still going through this thing where they'd come out every 10 or 15 minutes and they would call somebody's name. They called 2 or 3 hours before. And it was, very obvious that these people were no longer around this building. Their procedure needs to be reworked. The one proviso to this was the 911 emergency ambulance and helicopter that would arrive. These people were rushed back into the back of the hospital. I believe that either they waited in another area or they went straight to a doctor. So if you walk into the emergency room like I did, you could be waiting a while. Looks like the people that called 911 and get a hold of an ambulance or a helicopter are able to be seen by doctors a lot sooner. I was told someone could see me soon. Every 2 hours or so that I asked, by 1 a.m., I got so sleepy I couldn't stand. I had to go home. Had to go home from the emergency department. From my visit with Perry L. Savage, Sr., Ortho Alabama Spine and Sports, on September 4th, Birmingham, Alabama, is located off of Highway 11 near Trussville. I got a referral to UAB Neurology, UAB Neurosurgery. When I was leaving Ortho Alabama Spine and Sports at like 6:30 in the evening, after I had waited, it probably had 3 hours total in this visit and $300. And I didn't have much to show from this visit either. The referral is about as good as it got. Doctor looked at the images I took in, showing broken skull, MRI, CT, X-rays, brought in all that stuff on CDs, printed stuff out, brought it in and showed it to him. He did not note any abnormality. Clear images showing broken skull. I got a referral. Now, so as I'm leaving, he introduced me to a woman who's supposed to call me a few days later with my referral to UAB Neurology. So, anyways, I waited a day. I waited a few days. Went into weeks, and I never got a call from them. I had to call them back. Never received a follow-up call. They're running dozens of people through this place every couple of hours. It's ridiculous. So yeah, I must have fell through the cracks. My injury, I believe, is classifies as some kind of emergency issue, and it'd been like that for over a year. Now I was infected with parasite worms, and it was a whole other enchilada. But is waiting, more waiting, and real high-powered professional doctors who can't see a very obvious injury. Lots of money changing hands. Nobody's trying to help me. Finally called Ortho Alabama Spine and Sports back like a few weeks later. Because, they refer me to this neurology place. I'd already been to a neurologist who basically didn't help me for $260. So I wasn't too enthusiastic about going to another doctor and trying to get $300 more that I didn't have. But anyways, a few weeks later, I called them back, and they told me I was on a schedule with Dr. Mina Lubos, or Mina Labos, That's MINALOBBOUS, UAB Neurology, scheduled for December. And this visit was going to cost $300 also. So I had to wait 3 months. And I was going to pay $300 more. Yeah, I was down for this. But guess what? In a few months later, several months following this, I got a call from UAB Neurology, and guess what happened? My appointment, which I'd waited several months on already, had been canceled. They called me to tell me my appointment was canceled. And why? Dr. Mina Lubos' office, which is located in Birmingham, was going to move to Gardendale. So my appointment was canceled. And so I asked, okay, when are you going to reschedule it? And it hadn't been rescheduled. So they were going to reschedule it then. And I said, okay, well, when's the earliest appointment you have? And I was told it was January 2020. So it's a month later than the December appointment. Yeah, if a doctor's going to move offices, is that normal for the appointment to be to possibly be pushed back a month? Also, that doesn't make so much sense to me. Maybe a bunch more people, more important than me, got squeezed in that interim period. Maybe the guy went on vacation or something. I don't know. But anyways, they asked me if I was okay with my appointment being rescheduled, and I told them no. Yeah, I say at this point, like I've decided I'm going to start saying no to these people. They're not doing me a favor. They're not trying to help me. I wait months. I spend all this money. Nobody's trying to help me. I can't do this forever. I felt I was being scammed. Told them that it was urgent already, which you go look at my information, you'll understand how urgent this thing is. Very urgent. Basically, I could die any day, any time. I don't even have a diagnosis from July 25th, 2018. I have a broken skull infected by parasite worms. I have no idea what the diagnosis is. I don't know what I'm supposed to do, what I'm not supposed to do. Nobody's being honest with me. I'm getting sidetracked, just put off. Nobody's trying to help me. Oh yeah, and the other big hospital in town, St. Vincent, lied to me about this injury and tried to cover it up.